Imagine getting a small cut, and the bleeding does not stop the way it should. For most people, the body forms a clot quickly, but for some individuals born with a rare blood condition, the natural clotting process does not work properly. Today we are explaining FESILTY, also known as fibrinogen, human-chmt. This is an FDA-approved injectable treatment used to control active bleeding in people with a rare inherited bleeding disorder called congenital fibrinogen deficiency. This video will explain what fibrinogen does in the body, what congenital fibrinogen deficiency is, how FESILTY works, who it is approved for, why this approval is important, and what side effects patients should know about. When you get injured, your body activates a natural process to stop bleeding. First, blood platelets rush to the injured area to form a temporary plug. Then, clotting proteins in the blood work together to strengthen that plug. One of the most important clotting proteins is called fibrinogen, also known as clotting factor I. Fibrinogen is converted into fibrin, which forms a strong mesh that holds the clot together. This mesh stabilizes the clot and seals the injured blood vessel. If fibrinogen is missing or very low, the clot becomes weak, and bleeding may continue longer than normal. Congenital fibrinogen deficiency is a rare genetic disorder. It means a person is born with very low levels of fibrinogen or none at all. This happens due to changes in the genes responsible for producing fibrinogen. There are two main forms treated with FESILTY: hypofibrinogenemia, which means low fibrinogen levels, afibrinogenemia, which means almost no fibrinogen in the blood. People with this condition can experience frequent nosebleeds, easy bruising, heavy menstrual bleeding, prolonged bleeding after surgery or dental procedures, bleeding after injuries, and in severe cases, internal bleeding or bleeding into joints. Because this condition is rare, patients are often cared for by specialists in blood disorders called hematologists. The goal of treatment is simple: replace fibrinogen when bleeding occurs. Treatment options used in medical practice include plasma-derived fibrinogen concentrates, cryoprecipitate, which is a blood product containing fibrinogen, fresh frozen plasma, which contains many clotting proteins but lower concentrations of fibrinogen, and supportive medications to help stabilize clots in some situations. Fibrinogen concentrates are designed to deliver a known amount of fibrinogen in a smaller volume compared to plasma products. This allows for more precise dosing during bleeding episodes. FESILTY is a purified fibrinogen concentrate made from human plasma. It comes as a dry powder in a vial and is mixed with sterile water before being given through a vein. The medicine is processed with multiple safety steps to reduce the risk of transmitting viruses. Donor plasma is carefully screened, and the manufacturing process includes viral inactivation and removal steps. Even with these safety measures, plasma-derived products can never be considered completely risk-free for infectious transmission. FESILTY is approved to treat acute bleeding episodes in adults with congenital fibrinogen deficiency, children with congenital fibrinogen deficiency, including those with low fibrinogen levels or near absence of fibrinogen. FESILTY is not approved for dysfibrinogenemia, a condition where fibrinogen levels may be normal, but the protein does not function properly. This distinction is important because treatment approaches differ depending on the type of fibrinogen disorder. FDA approval means the medication has undergone scientific review for safety, manufacturing quality, and effectiveness for its approved use. For rare diseases, having additional approved treatment options is critical. It improves access to therapy, strengthens supply reliability, and gives doctors more flexibility when choosing the best option for individual patients. For patients and families affected by congenital fibrinogen deficiency, this approval represents progress in managing life-threatening bleeding episodes more effectively and predictably. FESILTY is given through an intravenous infusion, meaning directly into a vein. The dose depends on body weight, bleeding severity, and measured fibrinogen levels when available. Doctors aim to raise fibrinogen levels to about 100 milligrams per deciliter for minor bleeding, about 150 milligrams per deciliter for major bleeding. If fibrinogen levels are known, dosing is calculated based on how far the patient is from the target level. If fibrinogen levels are not immediately available, an initial weight-based dose is used and adjusted once lab results are obtained. Patients are monitored during and after infusion to assess response and safety. FESILTY directly replaces the missing clotting protein. This allows the body to form stable clots during active bleeding. Benefits include targeted replacement of fibrinogen, predictable dosing, and rapid correction of fibrinogen deficiency during bleeding episodes. This approach helps reduce prolonged bleeding and supports safer recovery from injuries and procedures. Like all clotting factor replacement therapies, FESILTY has important risks. Severe allergic reactions can occur, including life-threatening anaphylaxis. Patients with known severe hypersensitivity to fibrinogen products or any component of the formulation should not receive this medication. Blood clots have been reported with fibrinogen replacement therapy. Doctors carefully balance the need to stop bleeding against the risk of unwanted clot formation. Because the product is made from human plasma, there is a potential risk of transmitting infections, even with modern safety processes. Patients should report any unusual symptoms following treatment. Side effects reported with FESILTY include pain in the arms or legs, back pain, fever, headache, vomiting, allergic reactions, blood clots, and laboratory signs of increased clot breakdown activity. Not every patient experiences side effects. However, symptoms such as difficulty breathing, swelling of the face or throat, chest pain, or sudden limb swelling require urgent medical attention. FESILTY only replaces fibrinogen. It does not treat other bleeding disorders such as hemophilia A, hemophilia B, platelet disorders, or bleeding caused by vitamin K deficiency. Accurate diagnosis is essential to ensure the correct treatment is used for the correct condition. FESILTY is an FDA-approved fibrinogen replacement therapy. It treats acute bleeding episodes in people with congenital fibrinogen deficiency. It works by restoring a critical clotting protein needed for stable blood clots. Dosing is individualized and guided by body weight and fibrinogen levels. Important risks include allergic reactions, blood clots, and potential infectious risks. This approval expands treatment options for patients living with a rare and serious bleeding disorder. This video is for educational purposes only and does not replace professional medical advice. Patients should always consult their healthcare provider for diagnosis and treatment decisions. If you want clear, trustworthy explanations of new medicines and FDA approvals, subscribe to Drug Insight Hub. We break down complex medical topics into simple language that anyone can understand. Share this video to help raise awareness about rare bleeding disorders. And comment below, what drug should we explain next on Drug Insight Hub?